not break a leg. We don't need any problems with 2020.
You guys want me to start in 2 minutes, right?
Breaking. Yes, we are broadcasting.
Bye.
Well, hello, everybody. Thank you so much for joining us today. We're super excited to have all of you joining this webinar to discuss a little bit more about what's going on in Oklahoma. My name is Maria Christophic. I am the Area Senior Director for North Texas and Oklahoma. And myself, along with the panelists, we're again super excited to have you guys joining us today. If you want to switch to the next slide, and we can go ahead and get started. Awesome. We wanted to remind everyone who has heard and lived our mission, or for those of you that are new and haven't really known much about Autism Speaks, to kind of just mention our Autism Speaks mission. So the Autism Speaks mission is really dedicated to promoting solutions across the spectrum and throughout the lifespan for the needs of the individuals with autism and their families. We take pride as an organization not only supporting those individuals on the spectrum, but also the families and their support system. We do this through so many ways, including advocacy and support, which you'll hear a lot more about today, increasing understanding and acceptance of people with autism, advancing research into causes and better interventions for autism spectrum disorder, and then those related conditions. And with that, we do a lot of that through our partnership and collaboration. And so as you know, the panelists and the organization as a whole, we are very much committed to increasing global understanding and acceptance of people with autism, being really a huge catalyst for life-enhancing research breakthroughs, which you'll hear more about, increasing early childhood screening and timely interventions, improving the transition to adulthood, and finally ensuring access to reliable information and services throughout the lifespan. We did want to mention, take a quick little moment to talk about how everyone here on the call can get involved locally, but also what you can do to help support Autism Speaks and families and individuals on the spectrum within living in Oklahoma. So we are having an event. Because of all that's going on, we can't have a traditional physical walk, but we are excited to announce that we are redesigning our walk program for this year, and we are now going to have an event called Walk on Wheels. we're super excited about this. It's been in the works and planning for quite some time now. And so the final location will be mentioned here soon, but we will have support and participation through our partnership with Sonic, where we will have families via their car visiting several Sonic locations for incentives and prizes. And so stay tuned for more information on that. And if you want to register and join us on the day of, please go to act.autismspeaks.org/Oklahoma City to learn more, to register, and to join our efforts. And then we have a new Facebook group that we are very excited about. We share quite some bits of information on there that we know is useful for our families and supporters. So please visit our Facebook group here on the bottom. And if you guys have any questions, our contact information will be mentioned later. So please feel free to reach out. And I think that's it for me.
Hello there, everybody. My name is Krista Stevens, and I am a director with Autism Speaks of State Government Affairs. And I'll be helping with this presentation today, but the first slide we wanted to show you as we get the program started is just a disclaimer. It states that we are not providing any type of medical or legal advice, but that this is general information for our community that we hope can be useful and disseminated to all those who need it. We're encouraging you to trust the providers that you have access to for the type of advice that you need. And of course, we're available for you to contact us with any questions you have. I mentioned that my name and my position, but one thing I wanted to mention is that I'm also a mom to a daughter with autism. She's 15. This is a photo of her here. Her name is Eleanor. And as we're facing this COVID pandemic, I think it's worth it to just take a moment and think about how complex and taxing this situation has been on all of us. I think a lot of times we as autism families, we're in survival mode almost every day, and we're taking things one day at a time. But if you think about what we've been facing since March, I think you'll see that the reason you feel so overwhelmed is because there have been so many changes. We started a list here from feedback that people have shared with us, and it could go on and on. But some of these issues have been very disruptive to our families and to those with autism. A couple that I just want to mention, of course, school services, and then the uncertainty of going back to school and what should be the best choice for families to keep in mind, not only their child's progress and goals, but also their safety and health. That's a big decision for families, and we are hoping to provide lots of resources to help guide families. The shift to telehealth has been interesting. So many providers have tried to provide the services that our families need through telehealth, and while it's been very beneficial for many, there are others that have anxiety about that type of access. There's others who don't access a screen very well. I included this picture of my daughter because here she is doing speech therapy on her iPad, and she's actually smiling. And I tell you, it took about 3 months of many speech sessions each week to get her to the point where she was ready to actually work on her goals through a telehealth modality. So I captured that picture because it was just so amazing to see her engaging with her speech therapist. And I want to reassure you, if you've had trouble with that in your home, that you're not the only one, and it can take quite a while to get up and running on that method of accessing services. Our families have told us over and over again that the loss of income has been huge, not only to the family unit, but then also to the autistics have had employment that's been employment interrupted has been very difficult.
Apologies for the technical difficulties. I'm letting Krista know that she may want to turn her video camera off to see if that helps with her bandwidth. Krista, you may want to turn your camera off just because it may help your connectivity. We lost you there for a minute.
Here we go. Y'all can hear me now? Great. So anyway, we don't want to dwell on the difficulties, but we do want to acknowledge how complex the situation is. And we're here with resources for you, and we hope that you find them helpful. We hope that you disseminate them to others that you know that could use them. I want to mention that we welcome your questions in the chat box, and we will do our best to answer them during the webinar, but that if you don't get an answer, we will do our best to follow up with you one-on-one, either through the advocacy team or through the specialized support unit we have called the Autism Response Team. So let me tell you more about the Autism Response Team. Autism Speaks is so proud to offer this type of support to families and individuals. We get calls and chats and emails from people with autism, from their families, from teachers, people in the community, employers, and we want to provide the kind of information that they need. And so we have specialists that will share information, share resources, targeting the exact question that the person who reaches out poses to us. You can see there that Art can be contacted every day, Monday through Friday, all time zones from 9 to 5. We also have a chat line that's very convenient for folks. We have a Spanish line, and I've been told through Art as well that chat can be used through Spanish, and also they can receive emails in Spanish. Right now, informally, we have the capability even to answer questions or speak with people that are use the language of Portuguese, Brazilian Portuguese, and we even have French speaker on the Art team. So we don't know how long we'll have that kind of support, but right now we're trying to make our access to resources as wide as possible. So please use this information, help@autismspeaks.org, and you'll get connected with the Autism Response Team. A little bit about the agenda for today. You've met Maria. She introduced the program. I am Krista Stevens. I'm in the third circle there, but I'm going to turn it over to Dave in a minute. He's going to talk to you about the federal, how things look on the federal front related to COVID. And he is our Senior Director in Policy and Federal Government Affairs. He's got a lot to share with you. The information on the federal side is rolling out on a day-to-day basis, and he has some new information that he'll be sharing. I'll talk to you about state government advocacy in Oklahoma and have resources and information to share with you on the Oklahoma side, the local side, and then most importantly, Colleen will come in with access to resources and tell you about how you can get more information and the kind of support that you need for your situation. So I'm going to turn it over to Dave. And here's his first slide.
Thanks, Krista. It's great to be with you all today. As Krista mentioned, my name's Dave Zukowski. I'm Senior Director of Policy and Federal Government Affairs. I'm based out of Washington, D.C. So what I wanted to do today is briefly go over a broad overview of what's been happening in Washington since the onset of the COVID-19 pandemic in the United States, and then talk about what Autism Speaks has specifically been advocating on. There's a lot of detail to all of the things I'm going to be discussing. I'm going to try to keep it to as high level as possible. But if there are things that you have more specific questions about, or things that you've heard about that I'm not covering, that I don't cover in here, please feel free to put it into the Q&A box or to write to us afterwards. We'd be happy to follow up. So back in March, Congress began taking action related to the COVID crisis. March 6th, the first bill passed in Congress, which provided $8.3 billion in emergency funding. This was really the opening salvo, if you will, in terms of the congressional response to the crisis. This provided a lot of money for the public health response to the crisis, but there was, of course, a recognition that a lot more would have to be done. And one thing just to note here is you'll see that we've labeled these bills as COVID 1, 2, 3, 3.5, which I'll explain. Really that's just the chronological order in which these bills have passed. We wanted to put that on there because if you're reading articles about the COVID response in Congress, sometimes this is how they're referred to in some of those articles. So in any case, March 6th, the first bill passed. And then on March 18th, the second bill related to the COVID response became law. That was the Families First Coronavirus Response Act. This bill was more responsive to individual and family needs, and then some other business and public health needs. The really important, one of the most important things that was included in here was the provision of emergency paid sick and family leave for employees that or at employers with less than 500 employees. I know that was a very confusing sentence, but and there are certain conditions under which you'd be able to avail yourselves of that. And so if you want more information about that, we do have some guidance documents from the Department of Labor that has more information on that. But needless to say, this has been an important provision, particularly for those impacted directly by COVID in terms of illness for them or their family members, as well as this allows for individuals whose kids' school or daycare were closed to be able to avail themselves of this policy. The Families First law also had a number of other provisions, including an increase in Medicaid funding, which is important, some testing related provisions and food assistance. But on March 27th, the bill that I'm sure all of you have heard about in one form or another passed, the COVID-3 bill, the Coronavirus Aid, Relief, and Economic Security Act, or CARES as it's also known as, became law. And that is the probably most notable of everything that has passed so far, because it was the $2 trillion relief package that provided assistance across the board. So for example, the $1,200 per person, $500 per dependent under age 17 stimulus checks, or economic impact payments as they're known, were included in this law. The increased unemployment benefits that provided $600 and on top of other benefits, unemployment benefits was included in here. The Paycheck Protection Program, which was a forgivable loan program for small businesses to keep people on payroll, was included in there. There was billions of dollars for the public health response, for state and local governments to address the their COVID response, billions of dollars for schools, which we'll touch on later on in the presentation, and an extension of the Money Follows the Person program. So, and a myriad of other really very important provisions related to housing and other elements. And again, happy to answer any specific questions on that. But even at that point on March 27th, there was recognition that there would need to be additional action taken. And so since then, there have been a lot of discussions and negotiations. One thing that did pass on April 24th was the Paycheck Protection Program and Healthcare Enhancement Act. The reason that it's identified here as COVID 3.5 is because those larger negotiations around an additional trillions of dollar relief package are still ongoing even to this day, and I'll get to that in just a minute. But the Paycheck Protection Program, which provided the assistance for small businesses, ran out of money really quickly. And there was a desire to replenish those funds and to also provide money for hospitals and healthcare providers and for testing at the same time. And so the law that passed on April 24th was really narrow in just addressing those specific issues. Can you go to the next slide, please? So that brings us to what's next. The negotiations have heated up over the past few days. On May 15th, so a few months back, the House of Representatives actually passed a bill that's called the HEROES Act. It's a $3 trillion package. It provided $1 trillion for state and local governments. It addressed a bunch of housing related issues. It provided for additional economic impact payments, continued unemployment benefits, et cetera. And at that time that the bill passed in the House, the Senate Majority Leader, Senator McConnell, indicated that they wouldn't be taking up this bill in the form that it was in. And so the way to view this is kind of the opening salvo in those negotiations and the House's position on the priorities that they would like to see included in a final bill. And some priorities just to mention that were included in there, there was a substantial increase in funding for home and community-based services. There was a large $100 billion investment in education funding, and as noted here, that's on top of $1 trillion in more general assistance to state and local governments. So one issue that had come up with the CARES Act is that only dependents under the age of 17 were eligible for the $500 economic impact payments. This is something that many saw as unfair. We heard from a lot of individuals and families in the autism community about this. And so, we've been advocating, along with many other groups, to fix that both retroactively and to be accounted for in any additional payments. And so, what the HEROES Act did is it would retroactively make those payments, and then allow eligibility for future payments as well for dependents over age 17. But again, still very much an opening salvo. None of that has become law yet. And then on July 27th, which was just a couple days ago, the Senate released its own $1 trillion relief package proposal. And similar to the House, this is very much an opening bid, an opening offer from the Senate on a variety of different measures. So, for example, they include an additional stimulus check, $1,200 stimulus check. They would, in their bill, have a $500 economic impact payment, allowing all dependents to be eligible for that. They included $105 billion for education, and splitting that up amongst higher ed and in elementary and secondary education with some strings attached to that. But the bottom line right now is there's a very active negotiation that's happening between the House, the White House, and the Senate. And while a lot of ideas have been proposed, or in the case of the House, formally passed through the House, we don't have certainty yet as to what a final agreement would look like. Both chambers are scheduled to leave on August 7th, so there's a lot of impetus on their part to try to get something done before that deadline. Although it seems like there is a high likelihood if an agreement isn't reached by that point that they will stay in session. But I can't tell you that for certain, and we just don't know. But I think because of the expiration of the unemployment benefits, the enhanced unemployment benefits that occurs at the end of this week, the end of the eviction moratorium, a whole host of other issues, there's a lot of interest in trying to do something quickly. Can you go to the next slide, please? So I just wanted to talk briefly about some of our advocacy priorities during this crisis. We've spent a lot of time trying to listen to the community, try to hear the specific concerns that individuals and families are experiencing, and to try to translate that into action and in terms of our advocacy with federal lawmakers. So while we are always in touch with members of Congress, senators and their offices on a whole host of fronts, we've quickly pivoted towards advocating related to COVID priorities. So I've outlined here a number of things, but of course, it's not. We're not limited to just these priorities, and of course, if there are things that you believe that we should be taking a look at, please let us know. So the first one, additional funding for home and community-based services. As I mentioned, the House had included this. It's an increase in funding that would go to states for these services to help shorten wait lists, to provide personal protective equipment, PPE, to caregivers, just for a whole variety of different purposes. We know that there's a huge need for more funding. And so we've been advocating for that. We've been advocating for additional funding to meet the educational needs of students with autism. And this is in terms of the federal government providing funding to state and local school districts to ensure that whether it's a virtual setting, or for when students return to in-person setting, that schools have the resources to provide services for students to be able to both meet their needs now and then also address learning loss that we know is occurring right now because of this crisis. The next bullet is protecting the rights of students under the Individuals with Disabilities Education Act and other laws. We wanted to ensure that despite the really terrible situation that we're in right now, that there wouldn't be any rolling back of the rights that have been so hard fought for in IDEA. And while there was some discussion of that potentially occurring, that there'd be an allowance for waivers, that has not taken place. We have advocated against that. Many other groups have advocated against that, and to this point, Congress has not done that. And even the Secretary of Education has actually put out a report saying that no waivers of the core tenets of IDEA are necessary. But we stay vigilant and continue to monitor that. Expanded access to telehealth services for healthcare needs. Of course, telehealth is not always the same as in-person healthcare, and for some services, it really doesn't meet the needs of individuals in the autism community. And then for others, it's been a very positive thing and something where there's been an ability to access important services. So what we've been advocating for is to ensure that the ability to access telehealth services that are working continues, not just through this crisis, but even on an ongoing basis once we're past it. But that those telehealth services or increased access to telehealth services shouldn't come at the expense of the provision of in-person healthcare in the future. And so that's where we've been advocating with both Congress and the administration. So I talked about eligibility for the $500 economic impact payments for dependents over age 17. We've made a lot of progress on this, and it seems like there's some coalescence around this idea of just ensuring that whatever the next bill looks like, that this issue is taken into account, that there isn't a continued inequity with dependents over the age of 17. According to caregivers of adults with disabilities, the same emergency paid sick and family leave policies according to caregivers of children. So going back to what I was talking about related to paid sick and family medical leave, the way the law was written, it allowed for individuals whose kids' school or daycare center was closed because of the crisis to be able to access emergency paid sick and family medical leave, but it was less clear about the caregivers of adults with disabilities whose normal source of care was upended and not available. And so we wrote to the Department of Labor, others wrote to the Department of Labor as well. And fortunately, in their interpretation of the law, they've said that all caregivers, caregivers of adults with disabilities are covered, or the parents, I should say, are covered. And then lastly, but not least, preventing discrimination in treatment decisions and care allocation based on disability. We've been concerned about this throughout the crisis, especially at the outset. where there had been a lot of stories of with limited resources, physicians or healthcare providers making decisions based on whether or not someone had a disability in terms of providing care. And so we were pleased to see that the Department of Health and Human Services, Office of Civil Rights, issued a guidance document to medical providers across the country, basically telling them that they should not be engaged in this practice. And we continue on a number of different fronts to look at this issue of ensuring that resources are allocated in the right way. So, for example, ensuring that personal protective equipment is available in the group home setting. Another issue we've been advocating on is ensuring that hospitals have visitation policies that allow for a caregiver to be there during a hospital stay, whether it be for COVID or not, for someone with a disability. So I just wanted to mention, we've been engaged with members of Congress throughout this. We actually had on a call with some Oklahoma advocates a few months back, a member of Congressman Tom Cole's staff. We have been working with the heads of the Congressional Autism Caucus, that's Congressman Chris Smith and Mike Doyle, on advocating for some of these priorities that we've articulated here. And they've in turn sent letters to congressional leadership along with other members of the House bipartisanly advocating for many of these priorities. And we continue to stay engaged. We are continuing to send out action alerts. So something to look out for. To continue our engagement and bring in the voices of the community as well to advocate for these priorities. So anyway, I know I threw a lot of information at you. I appreciate the opportunity to talk with you all and happy to take any questions.
Dave, we do have one question that it may be more situational that would need a little follow-up, but I thought I'd ask it in case it's something that you would be able to address right off the bat. So this individual has an adult disabled child who receives SSI and knows other people who do as well. So SSI is relevant here, but they're also dependents on their tax returns. And in some cases, people received the $1,200 stimulus for that disabled adult, and in other cases not. So they're wondering, the ones who received it, is there any chance they would be required to return it? Or, there's just some confusion around adult dependents versus disabled adults that receive SSI and where the lines are.
It's a great question, and if I could ask this individual to please write into us separately about this, I'd love to follow up directly on that. Let me just say, I'll just say generally, because of the way that this law, the law was put together in such a quick manner, there were a lot of challenges that occurred in terms of implementing this. So we had issues where, initially SSI beneficiaries weren't automatically getting payments, and a lot of Social Security beneficiaries weren't getting payments automatically, and then that was fixed. There were a whole host of problems with the way that this rolled out. And I have heard about this specific concern, and actually some members of Congress are working on legislation related to this concern about the potential for because of errors, SSI beneficiaries having to pay back money, but nothing has been formally announced yet, to my knowledge, about that. So I would just really like to follow up directly, if we could, just to kind of get a better sense of that the personal situation. But please, thank you again for raising this, and please do connect with us.
Great, thanks, Dave. I shared your email address so that the individual can reach out to you.
Great, thank you.
And let's see, yeah, that's it for now. Thank you.
Great. Thanks so much, Dave and Kelly, for fielding those questions. I want to make sure that I don't break up again, so I'm going to stay off video. But I'm here with you. It's live, and unfortunately, sometimes with bandwidth and such, we just can't all be on screen. Just a reminder that because of this issue with bandwidth, we are just doing your questions in the chat box. But like you saw, Kelly, we'll be happy to
Krista, your audio is still breaking up some. Krista, you're in and out. I don't know if you can hear me.
I can hear you.
Okay.
Should I try again, or should I go back?
Yeah, you're in and out. I'll just let you know if we have a problem again, but please proceed.
Okay. So it'll be posted on our Autism Speaks web YouTube channel, and then also we will be sending the presentation out to your email address, and you will be able to click through the slides, use all the links that are live in here to see more information or see the information that we relied on to put together this presentation. So that'll be coming to you automatically, and you can feel free to distribute it any way you would like. Okay, so let's move on. I'm going to help now with the state advocacy response to the COVID crisis and tell you about how we've been working with Oklahoma officials to bring the voice of our community to them and help them respond to the issues that we're facing. So like Dave mentioned, we did a lot of information gathering at the beginning of the COVID crisis, and we've basically focused on 3 different areas of advocacy. We have a focus on healthcare, home and community-based services, and special education. And most of the experiences related to COVID can fall into one of these 3 advocacy buckets, but please know that there are lots of little loose ends that we're working on as well. The other thing is that the information that we gather is from people who take the time or have the time to share with us what they're experiencing, and we're always looking for new voices, new people to add to our advocacy in Oklahoma. We have calls where we get interested family members, advocates on the call, and we brainstorm and we talk through the issues that people in Oklahoma are facing, and we put together ideas on how we can best advocate. So if this is the starting point of your involvement with us, please seek us out for more involvement. We'd be happy to get you in on those calls so that you can add your voice to the information that we use to decide on the advocacy goals. And then you can also help us on the ground with the advocacy that we need from family members, community members, people who love and care for those with autism. So let's start with healthcare and how we've been advocating in Oklahoma relating to healthcare since the COVID crisis. So first thing is that there was an emergency waiver that the state of Oklahoma submitted to the Centers for Medicaid and Medicare Services. And that was the 1135 emergency waiver. And basically in that waiver, actually they submitted 2, they asked CMS to provide more flexibility on how healthcare could be administered to those who are in Sooner Care, the Sooner Care Health Plan. So CMS approved those requests, and because of that, these different areas of focus were provided with additional flexibility so that they could modify how the healthcare was being distributed to those in Oklahoma. One example of this was that the telehealth services were greatly expanded during COVID-19. And this is actually an interesting area for our families, and it moved us along further, being able to access this method of receiving services. I heard recently on the news that developmental pediatricians, for example, have wait lists that sometimes go on for months and months, sometimes into the years. And right now they have cleared their wait lists because they can see so many more families and children through telehealth. And that is really good news for our families. So this type of flexibility has been a good positive experience or aspect of the COVID crisis. The organization in Oklahoma that administers the Sooner Care, the Oklahoma Healthcare Authority, they have said that they're going to reevaluate the expansion of telehealth at the end of September, and they're going to decide if that expansion should be extended past the end of September. So we're going to be monitoring that and advocating for that to happen. So please stay tuned for more information on that as we get towards the end of September. For private health insurance, so this is not Sooner Care, but private health insurance, a group of advocacy groups sent a letter to the Oklahoma Insurance Commissioner asking for the type of flexibility for telehealth that Sooner Care recipients had received. And the insurance commissioner did not execute any type of statement requiring private healthcare insurance to offer those telehealth services, but several of the main ones have proactively provided that flexibility. And as examples, Blue Cross Blue Shield and Aetna, and then Health Choice for the state employees, all of these private health insurance organizations have demonstrated that they're interested in the flexibility for telehealth services for their customers. And keep in mind that telehealth services can be over a wide range of different services that people with autism and their families can access. Behavioral health services, including applied behavior analysis, can be delivered through telehealth. Speech, occupational, and physical therapy. I showed you the picture of my daughter with her speech therapist. Now, it does involve, family support in most instances. You do need to, be with the person who is receiving the service, but it does give that caregiver the support they need and the guidance they need to help the person with autism through the various activities that are part of the program. And then there's also psychological and psychiatric care that can be delivered through telehealth. You can have video counseling sessions, medication checks, all of those things have been successfully delivered through telehealth. That is not to say, though, that everything is the same with telehealth. We recognize that, and of course, the providers recognize that too. But in the situation we're in with safety concerns, there is a reliance on telehealth that brings that access to those providers to individuals and families. Okay, moving on to the second bucket that we talked about, which is home and community-based services. I mentioned CMS before with relation to Sooner Care and met the Medicaid program. But home and community-based services are another component of how CMS tries to deliver services to families and individuals in need. Home and community-based services are also experiencing greater flexibility, which was approved through the Appendix K application that each state submitted to CMS. Oklahoma had 2 that they submitted, and they were approved. You can see a summary of exactly what the Oklahoma Healthcare Authority asked for, and then what was approved using the links here. At the beginning of as the crisis was unfolding, the Oklahoma Developmental Disabilities Director, Beth Scrutchins, was involved in one of our calls, and she listened as our Autism Speaks COVID meeting group talked to her about what was needed in order to use the waivers that the Home and Community-Based Services program are delivered through. And from that kind of conversation, she then put together the Appendix K application. So we're really grateful that Oklahoma's main official for this area was willing to listen to the community and turned to, it was involved with Autism Speaks organizations group to gather information and communicate that to her. You'll see here, these are some of the emergency flexibilities that were approved. Basically, you'll see the word temporary there across the board. So this is in response to the crisis, there are going to be increased flexibilities in these different areas. Perhaps, for example, there was a limit or a restriction on where a specific service could be provided. Perhaps speech therapy had to be provided in the medical clinic's office, whereas now the idea is that it could be provided in different settings. Perhaps employment training was going to be administered through a specific employer. Well, now the idea is that that could be modified and be accessed in a way that's less restrictive. So again, how can they deliver the services that our families need, individuals need, but yet not be so bound by the restrictions that were originally in place? Okay, the third bucket is special education, and this one is really near and dear to all of our hearts because we know how important access to good, solid, research-based education for our students is, and how important early intervention is to the outcome of those with autism. Here's an example of a letter that we sent to the State Director of Special Ed Services, Todd Lofton, and in it we outlined the concerns we had about how families who have students with autism, how that education was going to be interrupted or had been interrupted by the COVID crisis. Mr. Lofton responded and got involved in one of our Zoom calls to listen and to reply specifically to questions. And one of the things we asked him for is to use some of the governor's discretionary money to support the kinds of things you see here. Increased hardware, communication devices, assistive technology. We want to make sure that the transition to special education from early intervention is going to be appropriately supported for our little ones during this time. And then, of course, the transition to those who are going to online instruction. We want to make sure that it's feasible and supportive. And again, transition out of special education into adulthood. How can we make sure that those who need the benefit of that support get it, even though we're in the middle of this crisis. Here's a photo of an important group of advocates in Oklahoma, and Judith City, another one of the Autism Speaks directors of state government affairs. We're always looking for those who want to help us advocate in Oklahoma. You can see how to connect with us there. Twitter, Instagram, Facebook. We're happy to connect with all of you in any of these formats. Okay, Colleen, can you take it from here?
I sure can. Thanks, Krista. Hi, everybody. Thank you so much for joining us. I know we're really close to the top of the hour, but I wanted to share some really important resources with you through this time. Krista, if you can go to the next slide. We've already talked about the autism response team, and this is not an accident that this is here again. I cannot reiterate how important this team is. It is a resource that many people don't know about, and we want everyone to know about this. So there are 3 ways to contact the ART team. There is a phone call, it's an 800 number. There's an English and a Spanish speaking number that's listed here. You can email us at help@autismspeaks.org, and we most recently, about 2 months ago, added a new live chat. So if you go to autismspeaks.org, you'll see at the bottom of the screen that there's a live chat option, and you can ask questions, whatever you need. We will try to find an answer for you. I was on a webinar yesterday with a group of people talking about special education and going back to school, and they said, you know, we don't have the answers to everything because nobody does. That's really very true, because this is just such unprecedented times. But I've worked very closely with this team, and they are wonderful. This is open. It's an open hotline for anybody to call. We have self-advocates call, grandparents, parents, professionals that work in the field. It's just a wonderful resource, and they can help you find something. We know everybody's time is very precious, so they're just a wonderful group of men and women. Next slide, please. So when coronavirus really took hold, the services and supports team really sprung into action and started to create resources specifically around COVID. We also have worked with many of our community partners, grant recipients, and people who align with Autism Speaks to also compile their resources as well, because we're one organization. We know there's other organizations doing incredible work out there as well. So if you go to autismspeaks.org right now, the very top of our page has a gold banner with all the coronavirus resource links. And these are just a couple of examples of them. Right now, I think at the top of mind is virtual learning and summer activities, because some people are smack dab in not going back to school. Some people are. We know some people are going back to in-person, and some people are not. So these virtual learning and activities are fabulous. They're a bunch of different categories. They're age appropriate. They are just wonderful, and there's an abundance of them. The just regular link to our COVID resources, these will come up in different categories. So for families, professionals, healthcare providers, adults with autism. And once you click on one of those boxes, a bunch of new other resources will open up. Also, how to handle clinical care during this time when programs are closed and in-person learning and therapies are not happening. And then just in general, what should the autism community know about COVID? We do have a wonderful local Oklahoma Facebook page, so you can join our Facebook and Instagram channel at Autism Speaks Oklahoma. Next slide, please. So again, if you go to autismspeaks.org, another great thing that we've done within about the last 2 years is organize our topics so that you can just go in and click on one specific thing, and then a myriad of resources will open up once you click on those. So if you could see here, some of them below are financial planning, safety, we know is a huge issue right now. School, technology, health and wellness, behavioral challenges, which we also knew we've seen an increase for. Medical resources. Transition to adulthood has recently been revamped to a digital platform. This is really fabulous, because if you click on here, this new resource is called a roadmap to adulthood, and there's different roadmaps you can click on. You can click on what level of support you need. They're just absolutely fabulous. So please take advantage of these resources. If you're looking for something specific and you cannot locate it, that's a great opportunity to contact the Autism Response Team and they can find something for you. Next slide. Oh, and I think that's it. I wanted to just personally say, I also have a connection to autism. I've worked directly in this field for over 30 years. I'm very proud to work with this advocacy team, and I hope you know how hard they work on your behalf. We are all in this together. I know that it looks different for every single person, and I heard somebody say, you know, we're not all in the same boat because everybody's boat looks very different, and it's true, but we're definitely all weathering the same storm. And so please know Autism Speaks is here for you. We have an abundance of resources, and you have the advocacy team and everyone at Autism Speaks behind you every single day. So I'll turn it back over to Krista to take us home. But thanks so much for your time, everyone. Stay safe.
Well, thanks again. I want to be cognizant of time and wrap this up. And I thank all of you for your involvement, your activity to support us. We're happy to be here for you, and please let us know if these resources can be expanded in any way. And if you have more to share with us, you now know how to reach us. Thanks so much. Take care.